of this emergency. Let's talk about burns. Burns can be caused by dry heat, such as flame or hot surfaces, wet heat, such as boiling water or steam, chemicals, and electricity, all of which can cause pain, redness, blisters, and in more severe cases, charring of the skin and damage to the tissues. First aid would include immediately getting the person away from the source of the burn and rinsing the area with cold or lukewarm water for at least 20 minutes. Do not use hot water, lotions, or any other liquid. Cover the burned area and any blisters with sterile dressing or gauze. It's important to seek medical attention for chemical or electrical burns. Any burn larger than the injured person's hand, white or charred skin, and those located on the face and hands and genitals, especially if they cause blisters. Basic life support is also known as cardiopulmonary resuscitation, and it is a life-saving measure for persons who are suffering from cardiac arrest. It is important that we know this in our workplaces and in our homes and in our schools to ensure that there's some level of blood circulation to our vital organs and to those who are of our loved ones. Basic life support is also known as cardiopulmonary resuscitation. It is a life-saving measure for persons who are suffering from cardiac arrest and aims to ensure some level of blood circulation to vital organs until more definitive treatment can be administered. It can involve administering chest compressions with rescue breaths, mouth-to-mouth breathing, or just chest compressions only. This is known as hands-only CPR. And hands-only CPR may be given to teens and adults who collapse, but younger children should receive CPR with rescue breathing. Here are the steps to administering hands-only CPR. Step 1 involves calling immediately for help if a teen or an adult collapses. And step 2 includes locking your hands together with the fingers interlaced. And step 3, placing the hands at the center of the person's chest, push hard and fast. The aim is to deliver 100 fast, high-quality chest compressions in a minute. Continue this until the person arrives in the nearest emergency facility. Additional training is needed for providing CPR and rescue breathing. In situations where it is not safe for the person giving CPR, like in this pandemic, a filter must be used when giving rescue breaths. Let's move on to disabilities. What are the definitions of disabilities? A disability is the interaction of a person's health condition and his or her environment, and involves the impairment of a person's body structure or function, or mental functioning, some examples of which include the loss of a limb, loss of vision, or memory loss. Activity limitations such as difficulty seeing, hearing, walking, or problem solving would be some examples of disabilities, and participation restrictions in normal daily activities such as working, engaging in social and recreational activities, and obtaining healthcare and preventive services are some of the key characteristics of disabilities. Examples of disabilities include limb malformations, vision loss and hearing loss, developmental conditions such as cerebral palsy, autism spectrum disorders, and attention deficit hyperactive disorder, mental health conditions like depression and anxiety, learning disorders such as dyslexia, and it can present from birth to childhood or can be acquired through illness, trauma, and accidents, like in those people who may have had an amputation or lost a limb. Here are several examples of disabilities that one may encounter. Language disorders would include the difficulty understanding speech and written words, or expressing oneself verbally or non-verbally. It must be clearly distinguished from hearing loss and should be evaluated by a speech-language pathologist to help one develop the language skills. For learning disorders, we have different types like difficulty reading, which is dyslexia, difficulty writing, which is dysgraphia, and difficulty with simple arithmetic and math, which is dyscalculia, and should be evaluated by a pediatrician to rule out reasons such as underlying illness, stress, and psychosocial factors. Musculoskeletal disorders can be temporary, such as fractures and sprains, or they can be permanent, such as the amputation of limbs, arthritis, and illnesses like systemic lupus erythematosus that affect the muscles and bones. They can affect the child's mobility and ability to actively participate in school activities and to perform independent tasks. They need adequate supportive and rehabilitation services. Post-traumatic stress disorder comes from severe stress like violence at home or in the community, or being a victim of a crime, or trauma from disasters and other upsetting events. Some symptoms would include nightmares or reliving the event repeatedly, avoiding anything associated with a traumatic event, being easily startled, or acting helpless or withdrawn. If symptoms persist for longer than a month after the event, an evaluation from a mental health professional is required. Vision loss means that a child's eyesight cannot be corrected to what is normal for their age. It can be caused by blindness, low vision with extreme nearsightedness or a limited field of vision, or color blindness. It can be caused by malformation with eye development, like rubella or viral infections during the mother's pregnancy, tumors, or other underlying illnesses. And a referral to a pediatrician is very important. How can schools support students who live with disabilities? The Department of Education's special education program for students with varying physical, mental, and psychosocial disabilities have acted for support using the interventions like specialized classes with a smaller student-to-teacher ratio, accommodations for integration into regular classes, written and verbal information and instructions that can be understood by students with varying visual impairments, hearing impairments, and learning disabilities, and providing concrete examples like things that can be smelled, touched, listened to illustrate abstract and complicated concepts, making activities as short and concise as possible, giving immediate feedback and progress checks on tasks and activities, and encouraging cooperative learning strategies.